Hi, everybody who's here. My name is Thais Del Rio. I'm a policy analyst at Voices for Utah Children. We are a nonprofit public policy organization that advocates for all Utah children and their families. We work on an array of different social issues, including children's health and immigrant family policies, which is why we're super excited for this very long overdue change in allowing families and individuals to feel empowered to be able to, get coverage for the first time. Again, here with my friend Tatiana. Tatiana, I'll turn it over to you and introduce yourself.
Hi, everyone. Yes, I am Tatiana. I'm from Utah Health Policy Project. Our outreach program is Take Care Utah, where I'm a health access assistant and community organizer. So I help people and organizations get access to health insurance, specifically marketplace and Medicaid coverage. So we really want to make sure that everyone understands what coverage is out there for them and, what's most affordable. So yeah, I'm happy to be here.
Awesome. Thank you, Tatiana. Thanks for being here. Before we dive into some of the questions, I just wanted to give a little bit of background. How did we get here? What does this change mean for me and my family and my friends and loved ones? DACA has been around for over 10 years, and folks are just now getting the opportunity to get coverage through the marketplace. Folks have been barred from it for a very long time. And this change obviously did not happen overnight. It took years of persistency and advocacy from immigrant right groups and health advocates across the nation. So I would be remiss if I didn't give them a shout out, and for everyone who shared their stories and helped make this change possible. So this is really exciting. A little bit of, data of DACA recipients here in Utah. We have a little over 7,000 DACA recipients who live here in Utah. Many of them have lived in the US for over 22 years. So the US is, the only place a lot of these folks have ever known. And while DACA recipients are able to work and get coverage from their employer, there is still a lot of folks who are left out and aren't able to get employer-based insurance. And so these are, DACA recipients who are full-time students, who are self-employed, are full-time, stay-at-home parents or caregivers, or work part-time, right? And their employer doesn't offer health insurance. So a lot of reasons why folks haven't been able to get coverage. And so this is really a crucial opportunity for us to do that intentional outreach and let folks know of this new opportunity. So this went into effect last Friday. So folks are already getting enrolled. Some might be a little bit, hesitant, which is okay. They want to know more information. And so that's why we're here today. So Tatiana, before I turn it over to you, I do want to state something really important here. I know we've been talking a lot about DACA recipients, but this change does also expand to other immigrant groups. So if you are not a DACA recipient, you're like, oh, I don't know if I'll qualify. There are 5 other statuses that have been included in this change. So I want to go over those really briefly. So if you are a non-citizen with a work authorization document, so this is your I-766 document or your work permit. If you have one of those, you're also eligible for marketplace insurance. If you are a family unity beneficiary, you also qualify. If you are right now in the process of applying for your residency, right? If you're applying to get your green card and you have a pending application, you also qualify. If you know someone or you have a child who's under the age of 14, and they're in the process of applying for either asylum, withholding of removal, or relief under the Convention Against Torture Act, these kiddos no longer have to wait 180 days before they can apply for the marketplace. So that 180-day waiting period has been removed for these kiddos, and they can apply right away. And then lastly, if you are a special immigrant juvenile visa holder, you also now qualify for marketplace insurance. So just want to make sure we emphasize that and let folks know that, if you're not a DACA recipient, that's okay. You might fall under the lines of these other statuses that I just mentioned, and just want to, affirm that all the information we'll be sharing today will apply to you, even if you're not a DACA recipient. So, okay, Tatiana, sorry, I talked for a minute there. So Tatiana, like I said a little earlier today, this is the first time folks are navigating the marketplace. What can you share about what the marketplace even is? What kind of plans are available for folks? Someone who's never, done this before, what can you share about that?
Yeah, the marketplace is basically another, website where you can look at health insurance from different companies that are available in your state. And it's just a really good place where you can compare what options are available for you if you don't have any other options. So, like you mentioned, if your employer doesn't cover your health insurance, or you make a little bit too much money to be on Medicaid, or if there's any other kind of extenuating circumstance, like if you just barely got a residency or a citizenship status, or if you are a DACA recipient. These are kinds of documents that will help you find insurance for a really affordable price compared to anything else that private insurance companies have. And it's just a place where if you go onto the marketplace, there's lots of options there that you can find what works best for you.
What are some of the most common plans you see here
Yeah.
in Utah?
So here in the state of Utah, we work with a lot of community partners. So we work with the University of Utah, we work with Select Health, and then there's also other plans with like Aetna and Molina and Blue Cross Blue Shield. So people can really find whatever works best for them in the process. If there's a certain doctor that you need to see, or if there's like a certain procedure you need done, at Take Care Utah, we help people educate themselves about things that are important to their health so we can help look at plans and different coverage for what works best for you. The marketplace is really interesting because there's actually hundreds of plans available by state. And so, with those plans, you can choose what works best for you specifically. So if you are relatively healthy and you're thinking that you don't want to spend a lot from month to month and you don't think you're going to go to the doctor, choosing a bronze plan is probably better for you because that'll be cheaper on the month to month basis. It does have a higher deductible, but that's an option that's there for you in case an emergency happens. Or if you know you need a surgery or you're going to have a baby and you know that you need a lot more coverage for the year, there's gold plans. They're called the metal tier levels. So you can choose what kind of coverage and what kind of payment works best for you. There's not one set price. There's literally hundreds of plans.
Right. So it's super important to find someone that can help navigate and, provide more information on what the best plan may be based on your needs, since it sounds like there's hundreds, many of
Yeah,
them, right, on the marketplace.
absolutely.
So I think one of the great things with that, insurance, it's comprehensive, right? And, a lot of really great things in terms of taking care of ourselves and really taking care of our mental health and seeking preventative care. What are some other benefits that people can expect as they enroll in a plan? What are some things that they can access once they have,
Yeah.
a plan?
So there's a lot of policy that makes sure that any kind of plan on the marketplace through the Affordable Care Act, it covers anything that's listed as an essential health benefit. So definitely preventive care is really important. That means that with all of the plans in the marketplace, you can get preventative care, any kind of screenings or vaccines, your annual physical, any plan, any metal tier level, bronze or gold, that those things are included in your plan. So there's basic things in every plan that mean, yes, you will absolutely get the coverage that you need and care will be there. And preventative care is really important. That goes super long term. But more than that, there's other things covered. Like most of the plans do cover mental health completely. And on top of that, you can also make sure that your plans cover women's health. If you need baby care, if you're having a baby, that's really important. Lots of the plans cover emergency room care. If you need to go to the ER for any kind of, accident or situation in the year, you definitely want to make sure that that care that gets delivered. And so, yeah, any kind of thing that you need with your health insurance, it's going to be covered by your health plan. And that's really the beauty of the marketplace, is that there's just so many options out there. And especially if you choose like a higher tier level, you're going to get more coverage included.
That's great. Can you expand a little bit on those different tiers? It sounds like there's three different plans that folks could choose from. Okay.
So, yes. in the metal tier levels, technically there's four, but we don't see platinum plans as much in Utah. But
Mhm.
there's bronze, silver, and gold. Most of the time, if people choose a silver plan, they're eligible for something called cost saving reduction, meaning that if you have an eligible income throughout like 138% to 400% of the federal poverty level, any of the plans in the marketplace are already automatically discounted based on what your income is. But if you choose a silver plan, because that's middle premium, middle deductible, maximum coverage, you get extra savings for the quality of the plan itself. So there's lots of differences there. You know, deductibles change depending on your tier level and the company that you choose.
Mhm.
But the silver level is where, you know, coverage tends to be best for most of the clients that I've worked with.
No, that's great. And you brought up an excellent point about financial assistance that is available
Mhm.
through the marketplace itself. And I think that's definitely one of the things that is on folks' mind when they're looking through health coverage options is, can I afford it? And so you talked about cost sharing reductions. Can you talk a little bit more about the other subsidies that are available? And I just want to emphasize again, for DACA recipients and the other immigrant groups that I just mentioned, folks are eligible for these different subsidies. Of course, it's dependent on your income, but you do qualify them for them as well. So we have the CSRs, and I think there's another one as
Yeah.
well.
So the CSRs are, or the cost saving reductions, those are available at the silver tier level because those have the best preventive and prospective coverage within the plans. But on top of that, for all of the plans in the marketplace, due to a person's income, the premium tax
Mhm.
credits, those are available for anyone who's eligible in the marketplace. So if you don't have employer insurance, and as long as you have a qualifying citizenship or residency requirement, you automatically qualify for the premium tax credits. So depending on that income, if it's between
Mhm.
138% of the FPL to 400%, and depending on the size of your family,
Yeah.
we can help calculate that for you. That's, you know, math that people don't need to worry about. Everyone within that bracket will automatically count for a discount. So I've helped a lot of people, a lot of students specifically, who are international students or who are DACA recipients, even just this week, who have an income of about $20,000 for one person, putting them right at that 140% of the FPL. So they automatically are getting silver plans for
Mhm.
free in the marketplace. They
That's
qualify for over $400 of tax savings just through the marketplace because of all of those subsidies that apply. So it really is affordable, and it's
yeah,
really possible for people of any kind of residency requirement to get health insurance.
that's amazing. No, that's really exciting to hear. And I do want to maybe clarify for some folks who are new to some of this health insurance terms. The
Mhm.
cost sharing reductions, those subsidies help like your deductibles, right? That's how much you have to pay before your plan kicks in.
Right.
Right? And then your premium tax credits. So this helps folks have lower monthly payments. So your premium is how much you're paying to have health coverage, right? To have a
Exactly.
plan. Okay.
Exactly. I love talking about how health insurance is kind of like a house, and I'm more than happy to
Yeah.
talk to anyone about their health insurance and how their plan works. But your premium is like the monthly subscription that you pay, or, you know, your mortgage or your rent to the house. And then your deductible is the first flight of stairs, and your out-of-pocket max is the second flight of stairs. And every time you use your health plan, it's just one copay or one step up to each health like flight of payment. So
I
more than
love
happy
that.
to talk to that to
Yeah.
people about that. Yeah.
That's such a fun analogy. I love that. That's awesome.
Yeah.
Um, one thing too that I want to highlight with the premium tax credits, it's like you said, it's based on the income that an individual expects to make within
Mhm.
that year. So for a low caveat, right? If folks estimate their income too low, then they might get more help than they're actually eligible for, and they'll have to pay back that extra
Right.
money during tax season, right? But on the flip side, if you estimate your income too high for the year, you might get some of that money back as a tax refund. But folks at Take Care Utah and Tatiana, they'll help guide you, right, on what the
Right.
best estimate would be to make sure that you're not paying back during tax season.
Exactly. It's definitely best to estimate your income as accurately as possible.
Mm,
I, would rather have my money that I need on the week, on
totally.
like daily to buy groceries and the things that I need day to day rather than get it all back in my tax return. But yes, being as accurate as possible is definitely in everyone's best interest.
Totally. No, that's great. And that, that brings me to what can folks do right now to prepare if they want to schedule an appointment with you or other folks at Take Care Utah? What can they do to prepare right now? What sort of documents will they need? How can they schedule an appointment with you?
Yeah, absolutely. So, for any kind of citizenship or residency status, if you're preparing for looking at the marketplace or contacting us, I would have those documents ready, just making sure you know all of your document numbers, your social security number.
Mhm.
I would also make sure you know what income you estimate to make in 2025. So, especially if you work in self-employment, have your taxes ready from the last year and try to make a good estimate for the upcoming year. And if you are working a steady job and you know what your income will be that way,
Mhm.
just really make sure that you know what your hourly wage is or what your salary would be for the year. Knowing those things ahead of time just make the process easier, as well as knowing your address and all the social security numbers of people in your house, because we want to make sure that as many people that can get coverage will get coverage. So those are things that you can do there. And then if you need help, reach out to us at Take Care Utah. You can just visit our website, which is takecareutah.org. There's a scheduling tool on there where you can make an appointment at a time that works best for you, especially because we're in open enrollment season right now. We're really busy, but we want to make sure as many people can get help as possible. So open enrollment goes until December 15th of this year if you want to get coverage starting in January, but goes through January 15th if you want your coverage to start in February. Um, and then you can also call our office too. We have lots of people who are super willing to help. Our phone number is 801-433-2299. So yes, there's lots of resources available for people who want to get some help.
That's awesome. Thank you, Tatiana. And I do want to uplift an exciting part about this enrollment is that DACA recipients and the other immigrant groups that I mentioned do qualify for a special enrollment period. And so if folks do enroll and apply within now until the end of November, their coverage can start as early as December 1st. So we're encouraging folks out there to schedule an appointment with Take Care Utah with Tatiana. There's a lot of other places too that can help you get enrolled, or if you want to do it yourself, more power to you. That's amazing. And if you do it now, again, by the end of November 30th, your coverage can start as early as December 1st. So a lot of really great information there, what you can do right now to start preparing some of the documents that you'll need to help get enrolled. One of the things that folks have asked is, what documents will I need to verify my immigration status, which is a really important question. And I do want to say before I answer that the part where they ask for your immigration status and verify that is only asked for the person who is seeking coverage. So if you live in a mixed status household and other individuals don't qualify, they won't be asked what their immigration status is, or they won't be asked to provide any information on that person. The only person who will need to provide their social security number and the other immigration documents will be the person seeking coverage. And so with that being said, for DACA recipients themselves, the most common documents that you can bring to verify is either your I-766 document. So this is your work permit, your employment authorization card, or your I-797 notice of action document. So this is the document that DACA recipients get from USCIS when they have their deferred status approved. So that's the document. It's a one-pager, and off to the right, it'll show you the length of time that your deferred action status is current for. So those are a couple documents. There's other documents available as well, and we'll be sure to share on our highlight reel some of the different links and resources where you can go check out what other documents you can bring. And this is the two documents I just mentioned are for DACA recipients, and there's a really great resource out there that has all the different immigration statuses and all of the most common documents that those folks will have. So if you're don't know exactly what to bring over, this document will have really great information on there on what documents you can bring, so we can verify, so that they can verify your immigration status. So with that being said, I do want to address some additional common fears that folks may have. Rightfully so, right? There might be folks who are still a little wary about, well, should I apply? I'm not really sure. I think right now, especially with this week, folks might be feeling anxious and a little bit uncertain. But I think the best thing that we can do is to find things that we can control. And I think the most important thing is to be able to take care of ourselves and be able to take on and empower ourselves to take care of our health. And if you're eligible for this new rule, we really encourage you to seek out and apply. So one of the common fears that exists within this is, well, if I apply for marketplace insurance and get some of those financial assistance credits, will it affect my ability to adjust my status in the future? Will it affect mine or my family's ability? And the short answer to that is no. Enrolling in health coverage and receiving subsidies through the marketplace is not considered a public benefit, and it will not impact your ability to receive or to adjust your status to lawful permanent residence, or apply to citizenship in the future. It will not have an impact on that. The only thing that is considered public charge is if you, for example, if you are in a nursing care facility and you receive public benefit funding through Medicaid, that is something that would count towards public charge. But in what we're talking about right now, getting health coverage through the marketplace, getting financial assistance through the marketplace will not count as a public charge to you or your family. So want to make sure that we do share that. Hopefully that can calm some of the uncertainties or fears that community members rightfully so have regarding this new change, right? So as we're getting close to the end of our live, Tatiana, I want to ask you, it's one thing for folks to get enrolled, which is the number one step, right? That's the foundation. But it's another for folks to know how to utilize their coverage, right? Health insurance isn't just for emergencies, right? It's like you said, it's for preventative care that can help people stay healthy. What are some tips that you have for folks in navigating their plan, like finding in-network providers, or understanding what's covered? What's something that you all can do at Take Care Utah to help folks feel empowered to utilize their benefits?
So when we're helping people get access to healthcare, the first thing that we do is we make sure that their plans are already working in their day-to-day lives. So if they see a doctor that they've been paying out of pocket for, or they had insurance for before, we try to find a plan that already works with that doctor, and we try to make it work for them as best as possible. We do a lot of health education, so we will open up their insurance companies, find a doctor page or use a network kind of page, and we make sure that they understand where you can go to find doctors that are covered in your network, so that you're paying the least for the care that you need most, so that you know which emergency room to go to if you have an emergency pop up, and make sure it stays covered. Or if you need a referral to another doctor and you need more care, that you're going to a doctor who is within that plan already, so that it gets covered. Navigating your plan is really easy when you know where to go and know what to do with it. So we really just make sure that people are educated, because you really want to use all the privilege of health insurance that you get. And there's so much of it that is available to you that people just don't know about. So if you need a screening, those things are usually free. You just need to ask your family or your primary care doctor for that. So yeah, there's lots of things that we make sure that people are educated about, and we just show them how to do it themselves, usually using the health insurance plans app that they enroll in, or just their website. There's lots of tools that are available. And even more, if people have questions about their health plans, we really empower them to call the health plans themselves.
Totally.
And make sure that they're totally just understanding where their payments are going and what they are paying for, so they get the most out of it.
Absolutely. No, that's amazing. I love all the education that you all do when helping community members navigate their benefits. And again, I want to uplift that the assistance and the work that Take Care Utah does is free for community members.
Mhm.
So you can meet with them in person, you can meet with them virtually, anywhere. If you're anywhere in the state of Utah, right, you can meet with them
Yeah,
virtually. So a lot of different options there for folks. So no, that's great, Tatiana. Thank you.
sure.
We've talked a lot about the what and the how and the when, but I think before we end, it'd be great to take some time to talk about the why, right? And Tatiana, I know you help a lot of families, especially immigrant and refugee families, navigate this health insurance,
Mhm.
health system world. What have you noticed when families are able to get covered
Yeah.
for the first time? What does this mean for families? What would you share with folks who are listening in right now who may still be a little bit hesitant or like, oh, I don't know. What can you share?
I want to share a story of one of the clients that I worked with last year. So I helped a family who had mixed status family, and it was a little bit complicated at first. One of the parents qualified for Medicaid. It was a mixed family, also, meaning that some of the children were stepchildren and some of them were biological children of the family. And so one of the stepchildren was able to get CHIP and was referred to CHIP through the marketplace specifically.
Mm.
But the three other children were not eligible for CHIP just due to how the policies break down. Of the three other children and the father who chose to enroll in a marketplace plan, the year went on, and this was their first time having health insurance in a really long time. And I got an email back in, I think, September, maybe even August, saying that without enrolling in health insurance this year, after going to like a well child check for one of their children, they realized that their son actually had a specific kind of cancer, one that wasn't visible to the eye.
Mm.
It was a type of leukemia. And without having enrolled in health insurance, they wouldn't have been able to receive treatment. And the treatment took 3 months and they hit it really
Oh,
aggressively. But with that health insurance, they basically hit those benefits overnight. That child needed immediate emergency care, and they treated that child for 3 months, and he's in remission now. It was a really fast pop up, and he's still receiving treatment, but he's in remission. And so this cancer is something that they're able to keep an eye on. So without health insurance of receiving that well child check and then follow-ups on it, they wouldn't have been able to treat this child at all, and they may have lost their child. And so I think it's really important for people to understand that yes, preventive care is there, but it's also routine care. It's
yeah.
care if there's an emergency. Having health insurance is so important for all people because you want to live longer and you want to be with your family members longer. And this is something that's so important for a lot of people to have. There's so much research out there that shows that the more people are insured and enrolled in health insurance, the happier, the lower stress they experience because they know that someone has their back. Like having a medical problem is so
Yeah.
stressful and it can be so expensive. And so just having this knowledge that there is something out there that is protecting you against financial ruin and physical ruin, it really helps people in a
Yeah.
mental and physical way. So that's great. People gain the peace of mind. They don't worry about financial strain because there are maximum limits that you can spend in a year for health insurance. So there's a lot of protections for people who are enrolled in health insurance too. It's a good investment of a yearly amount of money, I would say. And especially for immigrant families and DACA recipients and communities who are marginalized and experiencing just chronic stress,
Mhm.
this is just one less thing to worry about. So it's better to avoid or to delay avoidance of care
Yeah.
than worry about like cost, like the fear of the cost if you're paying it in the future. It's just something that I really recommend for anyone that I work with.
Thank you, Tatiana. That was so well said. And I'm so happy that you were able to help that family navigate such a stressful time. And it sounds like you are all advocates creating advocates. And so this is just really, it's so exciting to hear. And you're absolutely right. Um, it's more than just a policy benefit. It's a gain for mental health, for your overall well-being and positive health outcomes. And there's still so much more work that needs to be done to ensure that we can expand health coverage for everybody, regardless of what their immigration status is. We know that having access to healthcare, having access to health coverage is a fundamental right. And there are a lot of advocates here in Utah, across the nation, ourselves, fighting and working towards making that a reality. So thank you, Tatiana, so much for all the great insights and information that you were able to share with us today. Again, we'll make sure to post a little highlight on our page that will have a list of all the different resources that we mentioned today, including information on Take Care Utah and where you can go to schedule an appointment. And if you have any additional questions that we weren't able to answer today, feel free to send us a DM and we'll be happy to help answer that for you. Otherwise, we'll go ahead and make sure to post this video on our page if you want to go back and listen in. Want to thank again Tatiana for taking her time with us today and just sharing all this amazing information. Thank you so much, Tatiana. It was great to chat with you today.
Yeah, thank you for having me. And if anyone needs to contact me directly, just reach out to our website. My information's there. I hope everyone has a great day.
Thank you. Bye, everyone.
Bye.